Bianca Miss.
Yes, ma'am. Yes, ma'am. Crystal, ma'am.
Bianca ma'am. Bianca ma'am.
Yes, ma'am. बोला ना.
Ma'am, right now I have sent one more YouTube link.
Okay.
Along with the earlier link, please send this link also. Explanation for that link is also there. I have sent a message also along with it.
Okay, ma'am. Will do.
It's on Women's Cell. Please forward it.
Okay. Okay, ma'am. Yeah.
You need to share your screen. Call me.
Crystal ma'am? Crystal ma'am? Crystal ma'am, are you there? Crystal ma'am?
Yes, miss.
Dr. Merit is there. So can you make her host?
Yeah, sure. I'll do it now, ma'am.
Because she has to
Yeah,
share the
I'll do
screen.
it. Yes. Bianca is done. Rana sir,
Okay, ma'am. Yeah.
Rana sir, do we have you?
I think Bipin sir is there with me, with us. I think so.
No, ma'am. Bipin sir would be leaving now. I'm making Rana sir the co-host. He will keep on admitting the students.
Okay.
Yeah. Dr. Merita. Bianca miss. Bianca miss.
Yeah, ma'am.
Bianca ma'am, will you please ask the doctor to make Dharmesh Rana sir a co-host because she is the host
Okay.
now. She will have to make it. Yeah.
Yeah.
Thank you.
Dr. Merita, are you there?
Yes, I'm here.
Ma'am, there's a Rana sir over here.
Dharmesh
Dharmesh
Rana.
Rana.
Okay.
So you making co-host?
Yes.
Good evening, everyone. The session will begin soon. Please keep your mics and cameras off at all times.
Voice is not coming.
Students, please keep your mics muted at all times.
Good evening to one and all present here for this much needed informative session on COVID 19. Team Women's Cell welcomes respected trustee of our college, Soman Thomas Sir, Chairman Sanjeev Sir, Principal Febina Colasso Ma'am, Vice Principal Bipin Sir, Supervisor Priyanka Bar Ma'am, all teachers and students. It is a matter of great honor for me to welcome and introduce our respected speaker for today, Dr. Merita Pushparaj. The coronavirus COVID 19 pandemic is defining global health crisis for our time and the greatest challenge we have faced since World War II. Since its emergency in Asia last year, the virus has spread to every continent except Antarctica. The death toll is staggering. People are losing their jobs and livelihood. The economy is under tremendous stress and we are facing probably second wave of the disease. Keeping in mind the need to educate each individual about the facts and clearing the misconceptions about COVID 19, Women's Cell has invited a very respected doctor, Dr. Merita Pushparaj, for this session today. Dr. Merita is known for providing holistic homeopathic treatment and has been practicing since last 22 years. It is my pleasure to welcome Dr. Merita to talk and interact with us on the subject of COVID 19 and its impact on our life. She will also be guiding us how to take care of ourselves in this difficult time. I now request Dr. Merita ma'am to take this session forward. Over to you, ma'am.
Thank you very much for your warm welcome. I want to thank each one of you, especially the college trustee, Mr. Soman Thomas sir, the chairman Sanjeev sir, Principal Fabina Kaloko ma'am, the vice principal Bipin sir, and supervisor Priyanka Bar ma'am. Thank you so much for giving me this opportunity to speak to all of you, especially to the dear children. Also, a thanks to Bianca Kolako ma'am for inviting me to this platform. So, we begin with this study on COVID, something that has been affecting the entire world on a whole. Okay, so to begin with, I want to make a study to explain to you there are three levels at which diseases affect on a large scale. This is a pandemic, the second is an epidemic, and the third is an endemic. Pandemic means when the disease has affected the entire world, it is called as pandemic. It's a worldwide disease causing massive loss of life and massive loss of even the economy as well. The second thing is the epidemic, which we call it affects a smaller portion of the area. It can be a country, it can be a continent. The third part is the endemic diseases. The endemic diseases it is restricted to a certain area. For example, you have this disease called as an elephantiasis, if you have heard, where you have the sickness, the symptoms of the legs becoming very huge, very swollen, and it looks like an elephant leg. So these are found in damp areas like West Bengal and Kerala, okay, where marshy areas. These are endemic diseases. An epidemic disease, the example of an epidemic disease would be something like cholera, affecting a bigger area, which many people are coming down with loose motions, and that will be very severe. And a pandemic is nothing, something like what we are facing today. This is a COVID virus. Then we have the SARS virus, which was found out a year back. Then we had the other earlier called as a Spanish flu virus, which you all have heard of. So these are the type of diseases which are affecting the world on a bigger scale. Okay, so now let me explain to all of you what is the meaning of COVID-19. How did we get this term COVID-19? It is derived from three things. That is, we split it into co and vid and 19. Okay, this, so CO is nothing but coronavirus, VID is the virus disease, and 19 is something which was found and developed in the year 2019. Okay, so this is how this word COVID is derived. Okay, so let us see something about the coronavirus. What is this coronavirus? So let me put on the first slide for you. The first slide. If you look at this picture here, can you see this ball-like structure? This is the virus body. And you have all these spikes which are coming up, which resembles a crown. So something which is like a round shaped body with spikes coming out from there, resembling a crown, is a coronavirus. And the virus replicates by something called as a RNA molecule. Some of you, especially the science students, I believe, mostly even you have learned in the 10th standard, you have DNA molecules, you have RNA molecules. So the RNA is nothing but ribonucleic acid. So these multiply by something called as RNA, and that is the basic structure of this virus. So this thing, what you're seeing here, is the coronavirus. Okay. Now, this is now in this first slide you have here, you're reading here, is that it's something very, very new. It has come into existence a year back. It was developed first in China, as we all know. Okay, and it's also called as a novel COVID-19. So what do you mean by novel? Novel means it is something very new. Coronavirus has been in this world for several years, and it is nothing new. But when we say novel coronavirus, means it's a new strain of coronavirus that has developed. So when does it become new? It is when this virus has jumped in from an animal into a human being, and then it has gone into a different form of replication, wherein the structure has changed and gone into the human body. And when such a virus enters into a human body, it creates a lot of destructions in the human body. Okay, so since it is a year old, we doctors have come to good conclusions about this virus, but it still is a baffling matter for most of us. And as you are reading it here, we are studying about the short term effect and the long term effect of the COVID virus on our body. Okay, so basically, it starts with a flu, like any other virus which affects our body. It creates a flu like symptom in any and every human being, okay, who is affected by this virus. But it could also eventually affect your lungs, your liver, kidneys, and even your brain. Okay. So this is the after effects of the flu in a person who has a low immune level. Okay. So now let's go to the next slide. Let's see this. Now in this slide, you will see how it spreads. Okay. So this disease is spread by droplet infection, what we call it as. Droplet infection is nothing but something which comes up when an infected person is sneezing or coughing without his mouth or nose covered. So what happens is the droplets are sprayed into the air. So when these droplets are sprayed into the air by a person who has not covered his nose or mouth, and it goes and falls onto some surfaces, or it even goes in contact with other people, then a person with low immunity will immediately catch the infection. That's why we call it as a droplet infection. So here we see it spreads between people within 6 feet of each other. Okay, so if you're standing in a radius away beyond 6 feet of the infected person, it may not affect you unless and until your immunity is really low and there is a wind blowing in your direction which carries the virus to you. An infected person can spread these droplets even if they don't feel sick. That is another group of symptoms, another group of patients which we call them as asymptomatic patients. Or they might be in just the period where they have just got the infection and they do not know that they are infected. Those are the people who are having no symptoms at all. If you check them with the thermometer, there will be no temperature. They may not have a cough, they may not have a cold, they may not have a sore throat. So such a person may just sneeze like any one of you or me are sneezing due to some dust. So they are sneezing and they are unaware that they are releasing these viruses into the air. Okay, so when these viruses they fall upon some object, it may be a table like in your classroom, it may fall upon the doorknob, it may fall upon the even on your board or anything, and you are unaware of it and you're just picking it up or touching it, and with the same dirty hands you are unaware that your hands are infected, and with the same hands you are rubbing your eyes or rubbing your nose or touching your mouth, immediately these viruses will enter into your oral cavity or into your nasal cavity or into your eyes. These are the 3 points of entry of the coronavirus. Okay, so let's look at the third slide. So here we see this is the human respiratory system, the upper part of the respiratory system. Okay, so here you see this is a nasal passage from where the viruses enter along with the air that you breathe. Okay, this is the nasal passage. This is the mouth. Okay, and this is the nasopharynx, what we call it. And there it goes down. There is a trachea out down here, the trachea, and there it goes down into your lungs. Okay, so the initial part of the infection is when the virus has entered into your nasal passage and it has gone and lodged itself here into the nasopharynx. pharynx. It settles in the cells that line your nose. So you have the viruses out here in your nose. You have it in the sinus cavities. You have it all around here. Okay. And it is lodging itself even here in your throat. So what happens is that you start sneezing. The person is sneezing. He's having a headache. He's feeling feverish and he's developing a sore throat. Okay. So for most of the people, this is where the infection stays. It is staying in the nose and in the throat. So when this happens, the symptoms will begin in this patient with a sneeze, with a sore throat and a cough. Okay. But in sometimes you may not feel anything for 2 weeks. The infection is already there, but nothing is happening. That is in people who have a good immunity, they will not have any symptoms. Okay. But as a virus, it starts to invade into the healthy cells. It goes inside the healthy cells and it has begun to reproduce in the healthy cells over there. And once it begins to reproduce, or in our terms, we say replicate in the cells, then that is a time of transmission. So unknowingly, this person is sneezing into the air or coughing into the air. Okay. And then the virus is expelled out. And an unknowing person who is not suspecting that you have got the infection has come in contact with these droplets and immediately they get infected. So you can transmit it to others even if you don't have any symptoms. Let's look at the next slide. In this slide, we will look at what are the symptoms that you will get in a patient suffering from COVID virus. So like I said, the patient may have just a mild fever. You have this thermometer. Okay, fever is something which we describe as anything above 99 degrees Fahrenheit or 38.6 degrees Celsius. Most of the patients come to me and they say, मैडम मुझे बुखार है. तो बुखार है मतलब क्या हो रहा है? नहीं, मुझे कुछ ठीक नहीं लग रहा है, मेरा बदन में दर्द हो रहा है, मुझे कुछ लग रहा है, पर किसी को ये पता नहीं है कि टेम्परेचर क्या बात है. So when you know what is this temperature thing, it is nothing but you on using the thermometer, your thermometer is showing you a temperature above 38.6. Okay, it's and 98.6 degrees Fahrenheit. So anything above 99, something touching around 37 degrees Celsius, 38 degrees Celsius and 40 or going up to 100 and 104, that is called as a fever. Then the first symptom being fever, then you have a sore throat, you have sneezing, you have dry cough, not a wet cough. It is a very dry cough. Okay. And also a headache. This is just the early stage of the infection. Then as the infection increases, then other symptoms will develop like shortness of breath, that is inability to breathe comfortably. Then the patient may also develop chills along with fever, feeling very, very cold with body ache. Then the patient may have a loss of smell or taste. That is because you find the virus is destroying or affecting the nerves. Then the patient also suffers from an unusual tiredness with a stuffy nose or a runny nose. And the last but not the least, which is common, is nausea or diarrhea, which we have seen very commonly. This diarrhea is not like the common diarrhea which you suffer like for 1 or 2 or 3 days, but this kind of diarrhea caused by the COVID virus can run up to 10 to 15 days also. Okay, let's look at the next slide. Okay, so in the third slide, I showed you the upper respiratory tract. Here, this is a lower respiratory tract. Beginning herein, this is a trachea, and you go down the trachea. These are the two bronchi, what we say, and it's opening up into the lung structure. Here you see these are the alveoli. These are the bronchioles, from the bronchi into the bronchioles, and these are all the alveoli. So here you are seeing it is the red linings which you are seeing is this is the inflammation. That is, it's lot of blood supply, excessive more of the blood supply here. Okay, so there's an infection into the lower respiratory tract when the person's immunity is extremely low. Then the infection has gone into the lungs. So in the first week of infection, the patient may not have any symptoms of the lungs, but as the virus goes down into the bronchi and the lungs, as we know, it is attacking. The work of the virus is to attack the cells and lining them up, or causing as the cells are getting destroyed, a lot of discharge is collecting there. There is fluid, there is mucus all collecting, which you call as balgam. In Hindi it is called as balgam. Okay, so this fluid, which is very thick, is not coming up into the throat. Some of it comes up and you are able to spit it up. And as the infection goes down the throat into the trachea, so what you see, there's more discharge collecting there, and there down into the bronchi and in the bronchioles, there's a lot of discharges collecting it inside this entire lung, the structure which you're seeing. And what happens, because there's so much of destruction happening in here with so much of discharges and the mucus in here, the airway is getting blocked. When the airway gets blocked with all these discharges, there is no way where you have the exchange of gases. As we all know, the exchange of oxygen and carbon dioxide cannot happen easily. Okay, so such patients will develop difficulty in breathing. This is called as pneumonia. What we all have been hearing, pneumonia. So this is precisely what we call as pneumonia. So the patients who have a better immunity will recover in a period of 2 weeks to 3 weeks, I would say. Not 1 or 2 as mentioned here, but it may take 2 to 3 weeks. But the others may take 1 month at least, those who are having a little severe infection. Okay, let's look at the next slide. Okay, so this is something which we call as ARDS. It is, the full form is acute respiratory distress syndrome. Okay, so this is found mostly in a patient who doesn't have, is chronically sick. A stands for acute. Acute means it has suddenly happened. That is the meaning of acute respiratory distress. So this patient is having a respiratory distress which has suddenly come, and it is very, very severe. So in this, what is happening is the COVID-19, the pneumonia gets worse very quickly, like I mentioned. That's why it's called as acute and it's called as distress. And your body's response can damage your lungs more. So here what is happening is, already the body is damaged, the lungs are damaged. There's a lot of fluid collection out there. But in addition to this, the patient's body is trying in an response, in an attempt to save its own self. It is trying to create a lot of security guards, what we call as the cytokine. So cytokine cells are released. So this may go into something called as a cytokine storm. So your body is invariably going into a destruction. Okay, can damage your lungs more. The tiny delicate air sacs called alveoli that transfer oxygen to your blood start to fill with junk, in your words. And when we check with X-ray, the only way we can find out is the X-ray and the CT scan. They find that the lungs, a small part or a big part of the lung, depending upon how much damage has taken place, it shows a patch, that is a pneumonia patch. Okay, so like I said, the oxygen levels in the blood are dangerously low, and such patients will need a ventilator. That's how you have been reading and hearing in the news. People are on ventilators, they're very serious and very sick, very, very sick. Those are the people who are with low immunity. Let's look at the next slide. This is the immune system issues, like I mentioned to you, cytokine storm. Okay, this is nothing but an overblown immune response in very weak individuals, where the body is trying desperately to fight against the infection. So the levels of chemical signaling agents, like I mentioned to you, is cytokines. They are increased to such an extent, so high, that they are begun not only to attack the virus, but they have also begun to attack the healthy tissues in your lungs. Okay, so this is what we call as a cytokine storm. Do you see all these blue things that are seen here? These are nothing but cytokines. They come together. It's a chemical release, and here there so much of them have been released and this created. It looks like a storm. It can lead to things like low blood pressure and organ failure and blood vessel damage. Let's look at the next slide. So like I mentioned to you earlier, one of the organ damages that occurs is the heart. Okay, so this is in this picture you're seeing this is a structure of the healthy heart, and this is the structure of the heart after the virus has affected it. Okay, now look at this lining here. As you know, this top chamber is the atrium and the lower portion is a ventricle. So you will look at this structure, that's the muscles of the ventricles. Here in this picture it's thin, but here on the right hand side this is a damaged heart where the muscles have enlarged, they have grown. That is because there's tremendous pressure on the heart, and the heart has to pump more of blood, because of which the heart develops a swelling, and so we call it as a cardiomyopathy. So when there is a severe increase in the muscle mass of the heart and due to excessive beating, it's called as arrhythmia. That is, it beats in wrong rhythms. We have cardiomyopathy, as I mentioned. Okay, a weak and a thick, stiff heart tissue. Then you have something called as acute cardiac injury, where the heart is getting damaged, and also the next is the shock. So where the patient goes into a shock and he dies. Can we see the next slide? We will look, like I mentioned, now this is the second organ that may be affected, and we find it very commonly. These are the blood vessels. So the COVID has now entered the blood vessels here. These are the arteries and these are the arterioles, as you know. Okay, so this red thing where the fresh oxygenated blood is moving in. Aside from the heart issues, it can also cause blood clots. So this viruses are gone into the blood and damaged inside the arterioles and created blood clots over there. And these blood clots can go into a person's brain, and it can cause something which we call as a stroke or a pulmonary embolism, that which happens in the lungs. That when the blood clot has gone into the brain, there it is caused a stroke. If it has gone into a lungs, it has caused a pulmonary embolism. And such people are very, very seriously ill. Okay, and let's look at the next one. This is the next third part which it affects. It may affect a very severely ill patient, that is the brain. Okay, so when it enters into the brain, so there, like I mentioned to you just previously, that there's, you see this black clot over here. It is a clot in the brain and creating a stroke. It can create called seizures. Yes, in Hindi it's called mirgi, convulsions. The patient may go into convulsions because of this blood clot, and there could be many issues. So the patient may be unconscious. Such patients, they are very, very severe. And the minor symptoms of affection of the brain is nothing but loss of smell and loss of taste, which we all know. Many patients are complaining कि मैडम मुझे कोई चीज का स्वाद नहीं आता है, ना ही मुझे कुछ भी खुशबू आती है या बदबू आती है. I cannot smell anything, I cannot taste anything, I don't know the taste of my food. Okay, so that is because of the effect of the virus on the brain. Let's look at the next slide. Then this is still more advanced. In most severe cases, that's a kidney damage. So this is common in people who are very seriously ill from COVID. That is, they're going into organ failures. And it's not only because of the COVID, but also because of medication. Because since it is a new virus, most of the doctors, what they do is they are putting in so many medicines to help the patient, that these medicines are going and getting filtered by the kidney. As you all know, if you know, the kidney works as a filter to your body. So it's when it's filtering so many medicines over there, so what's happening, most of the medicines are getting collected inside the kidney over there, And so a combination of the COVID effect, the medicines in the kidney, and the misfire of the immune system, that's a cytokine storm, which I mentioned to you. Already the patient is going through low blood pressure and various other problems. So what happens? He goes also into a kidney failure. We can go into the next slide. This is a liver issues. Like I mentioned to you, like the kidney, the liver also helps in works as a filter and in clearing up your blood. So the COVID virus can get into the liver and also affect the liver, create disturbances in the enzyme levels over there. So the patient will have digestive issues. Okay. So the medicines also which the patient is taking along with the COVID also is working upon the liver and creating all the kinds of complications in such a patient. Let's look into the next one. This is the eye problem. Majority of the people that we are seeing are suffering from something called as pink eye. It's like conjunctivitis, which you normally see. मुझे आँख आई है. It's red eyes, red swollen eyes, discharge from the eyes. Is generally a viral conjunctivitis, which you commonly see among the people. But here, COVID also creates such a symptom in patients. Okay. So that is why we have been telling you repeatedly, do not touch your eyes so that your eyes do not get infected by the COVID virus. Let's go to the next slide. Okay. Now here we see this is all about the asymptomatic patients. Okay. So asymptomatic patients, this is quite a big group of people who do not suffer from any kind of symptoms. Okay. So these people are these guys who have a good immunity and they are not developing any kind of symptoms. So they are not feeling sick. They do not have any sore throat. They do not have anything. They're happy and happy-go-lucky. They consider themselves as healthy and happy. So they are just fine, and unknowingly they are spreading the infection to others. So as you see, there are two groups, that is symptomatic patients and asymptomatic patients. So and 80% of the patients are just developing a very light infection. The rest of the 20 patients are the ones with low immunity, developing a severe infection, which the media is hyping it. Okay, we are finished with the first wave. We are done with the first wave, and now we are at this brink that there might be a second wave after the winter has set in. That's when most of the people are coming together, less of social distancing happening, so and people walking about with masks. So it's expected that a new wave will develop in a month or so. So my only advice to each one of you are, as I mentioned to you, take care about your face, cover your nose and your mouth with mask, so that even if an asymptomatic patient is coughing or sneezing into the air, we do not pick up the infection. And when you are going out, see that you are cleaning your hands and your constantly when you go out, when you touch something, make sure use a sanitizer when you're outside your home. When you come back home, use a soap to wash your hands. It would not be just like this washing your hand. It will be something like this. You go this way, you go this way, you go this way. So we have to ensure that all the hand surfaces are washed. Every part of your hand is washed, because the soap is enough to wash, to get into the fatty layer of the virus. I didn't mention to you, I'm sorry about it, but the outer layer of the virus is made out of fat, and the fatty layer is broken by soap. So soap and water is enough to break the virus, the cell structure, the cell layer of the virus. So we can wash our hands. That is very safe. Or when you're out of the house, use a sanitizer. That is also alcohol based sanitizer, which destroys the cell structure and the virus will not live. So we will not get infected. Keep a social distance of 6 feet from each person. Please ensure that yes, the rate of infection has dropped, but that does not mean that we will not get these cases again. Cases have again been increasing because social distancing has been reduced. So please take care when you go out. And another thing is, I want to show you this mask. I have two types of mask over here. This is a cloth mask. Yes, a cloth mask. Majority is available in the market, which you can wash and reuse. As you all know, we are covering ourselves with this, and then we wash it up after each use. And the best one that I would suggest is a 3-ply mask. This is what the surgeons use. Can you see this? If I cut it, I will show you how it looks. It is called a 3-ply because we have 3 layers in this, and it is very good for filtration of the virus. The virus will not enter into your nose. So here we have, I'll show you this quickly. This is the first layer of the mask. We have this white layer. So this is a 3-layer mask. Can you see this? So there is ample protection for us. As we breathe through it, the virus is getting filtered and it remains on the outer area. So once you have touched this, please again do not touch your face, your nose, and your eyes. Okay? After use of this should be cut off completely and thrown. Please do not dispose your mask as it is, because this can be reused. This is done. The work is done. Please cut it and dispose it off. Okay, that's all for today, students and teachers. I would invite you to ask whatever doubts you have. You can go ahead with your doubts.
Ma'am, may I?
Yes, please.
Ma'am, my question is, before this corona pandemic, if the person used to suffer from acute coryza, at that time also he would be infected with coronavirus only. But during this pandemic in India, SARS-CoV-2 virus has been spread. So I wanted to know what is the difference between that virus and this virus? Why this virus is deadly as compared to that virus?
Yes.
This was my doubt.
Your Bhavya? Okay. See,
Yes, ma'am. Bhavya.
like I mentioned to you earlier, coronavirus has been there for many years. It's nothing new. But this is a novel coronavirus. Like I mentioned to you, it's a new strain of coronavirus which has come into existence because it has jumped from an animal into a human being. So when it has jumped from an animal into a human being, what happens is there is some changes happening in the RNA structure of the virus. So that is why the virus has completely changed now and entered into the human being. Okay, so that structure, because of the change in the RNA, it is creating a lot of severe issues in the patients, unlike the previous coronaviruses. Did you understand?
Okay, miss. Thank you, miss.
You're welcome. Any other
Hello,
question?
ma'am.
Yes.
Ma'am, my doubt was, as we are hearing that vaccine is soon available to us, and like, will it be like the old normal life of ours? Like, we know this is our new normal, but after vaccine, will it be a old normal, or should we continue this precautions what we are doing now?
The precautions will have to be continued for quite some time. If you see, to explain it much better is, if you know, the swine flu virus was it came into the world somewhere 10, 11 years back. That was the first time swine flu came in. Yes. And at that time, initially, when the swine flu came in, it was very severe. For a year, it was severe. And after 1 year, the swine flu infections continued. But it was not too many cases of swine flu, and it was not so severe, it was not critical, many people weren't dying. So similarly, with this coronavirus also, like I mentioned to you, the initial phase is severe, which we are all completed. The initial phase is over, excuse me, and then we are continuing with this. The second wave is expected. Okay, and the people's immunity is improving. Something which we call as herd immunity has happened. Okay, immunity is nothing but our bodies producing antibodies to these viruses. Okay, so as immunity is increasing, people will not suffer much as compared to in the past 9 months. So I am not very much in favor of these vaccines because we never needed much vaccine during the swine flu virus also. Even now we will not need the viruses, sorry, the vaccines for this time. Because as far as I have read about some researches that the vaccines which are developing of now, it will interfere into the RNA of the human beings. So if it interferes into the RNA molecule of the human beings, it can create problems in the human cell structure and create problems. Yes, and life, coming to a second part of your question, life will be back to normal, but it is a good practice if we continue to use the social distancing and the mask, use of mask, because I myself am benefiting from this in my practice. Earlier, I would see, when I would see so many patients, even during the swine flu pandemic, I didn't get swine flu, neither did any of my patients get, because that time also I was using the mask. And now, during from the time this pandemic of COVID has begun, I myself have again begun to use the mask with the sanitizers and social distancing, and none of us have been affected by this again. So I think this is the best thing to do is maintain the safe distancing and use clean hands.
Ma'am, may I
Thank
ask
you,
a
ma'am.
question?
Yes, Aditi.
The virus is still going, but the ones who are working and they are testing positive for the coronavirus, still they are being cured. So, what kind of treatment they are getting?
See, as such viral infections, we don't have in allopathy, they don't have any antivirals specifically to work upon these viruses, which will destroy these viruses directly. Okay, of course, the latest ones have come in and they are using it, but as such, overall viral infections need just a period of 2 to 3 days to 1 week to recover. Okay, so many of the patients are recovering even without medicines. It's only the very severe patients, serious patients are the ones with low immunity, something like a blood pressure and diabetes and thyroid infections, thyroid levels, which are low or high. So when there's a complication in the human body, only then the infection will be severe and that needs to be really treated.
Okay, ma'am. Thank you.
Welcome.
Ma'am,
Yes,
vaccine has been released or not?
it's released in UK and will be released shortly in India. Any more questions, please?
Ma'am, my question is about the person who is suffering from corona and he is cured. There is a possibility to be again suffering from corona or at once.
If his immunity is very low, if he has not fully come out of the infection, then he may develop something called as double pneumonia, which is common even in other infections, not necessarily COVID alone, but there may be some other infections also, wherein if the person's immunity is low, he develops something called as a double pneumonia. Okay?
Okay, ma'am. Thank you.
You're welcome.
Excuse me, ma'am.
Yes.
One last question from my side. Ma'am, as we know that during the early phases when this COVID-19 virus was spread, at that time in hospitals, hydroxychloroquine was used in this treatment for COVID virus, which is
Yes.
similarly used for malaria.
Yes.
So that medicine has some side effects on the COVID patients, or it's just likely with no side effects.
There are side effects of that.
Ma'am, what can be the side
Every
effects
medicine.
on chronic?
See, like I mentioned to you, I showed you on the slides that it is these not only the COVID, but also these medications that are affecting the patient's kidney and the liver. Okay, these are the prime centers of effect of these medicines, hydroxychloroquine. So the patient can come down with an active failure also in the due process.
Good afternoon, ma'am.
Good afternoon.
Yes, ma'am. My question is, as you have mentioned that the vaccine can interfere with the structure of the human RNA, but the whole world is waiting for the vaccine, and the doctors and the teachers are going to be vaccinated first, as
Yes.
we all know.
Yes.
So, what should we do? Do we have uh, means we should be vaccinated or not? As
I,
you have mentioned that it can modify or it can change the structure of the RNA.
it's a personal choice, I would say, for that matter. Like, for example, when you go to the pediatrician for your babies, what will you do? The doctor will give you a complete list of vaccination to be given to a child, right? I would say
Yes.
yes. So, see, in my case, I will explain like when I was young, I was not given so many vaccines as was prescribed for my children and the children nowadays. Nowadays, children are given anything to the tune of 20 to 25 vaccines. But we as children were given something around only 10 vaccines total in our life. If we have survived well and our parents also have survived well through all the infections, then why would we need such a vaccine? This is my feeling, because my parents also have been through an epidemic of, the very severe smallpox infection when they were small, and people have survived it. They have survived even cholera. So I don't think there is any need for it. It's a personal choice.
Okay, ma'am. Thank you, ma'am.
You're welcome.
Ma'am,
Yes.
now what about the result of COVID-19?
In what sense?
Means अभी जो result क्या है COVID-19 का ऐसा? Patients are more or not?
पेशेंट तो अभी बढ़ रहे हैं, ग्रेजुअली बढ़ रहे हैं अभी। जैसे कि आप लोग को पता है, इनिशियली लॉकडाउन थी तो क्या सोशल डिस्टेंसिंग मेंटेन हो रहा था, तो लोग ज्यादातर क्राउडिंग नहीं कर रहे थे, तो तब तक इन्फेक्शन का मात्रा जो है वो बढ़ तो रहा था तभी, बिकॉज ऑफ द फर्स्ट वेव। लेकिन जैसे लॉकडाउन खुल गया, इट वाज जस्ट उसी समय पे खुल गया जब वायरस का इन्फेक्शन कम हुआ था। और जैसे अभी लोग मिल रहे हैं एक दूसरे से, डिस्टेंसिंग कम हो गई है, एंड इवन पीपल कई जगह मास्क भी नहीं पहन रहे हैं, तो ये इन्फेक्शन वापस बढ़ रही है। एंड एज वी आर सीइंग नाउ, इवन कंटेनमेंट जोन्स हैव कम इन, वेर इन काफी लोग इन्फेक्ट हो गए हैं और हो रहे हैं। और यूजुअली हम दूसरी बात हम ये देखते हैं कि नॉर्मली साधारणता भी जो है, जैसे ठंडी बढ़ती है, जैसे ये विंटर बढ़ रही है, बाकी के इन्फेक्शंस भी शुरुआत होती है ये महीने में और अगली महीने में। सो यू विल हैव अदर वायरल इन्फेक्शंस आल्सो कमिंग अप एंड बैक्टीरियल इन्फेक्शंस आल्सो कमिंग अप नाउ। तो ये बढ़ेगा थोड़ा बहुत।
Okay, thank you so much, ma'am.
You're welcome.
Hello, ma'am.
Yes.
As we recently read that the plasma of recovered patients are used to treat other patients. So, how the plasma helps to treat the COVID? Can you please explain?
Yeah, like I mentioned to you, the in a if I can share you the screen, there is one place where there's a structure of the virus. I was running out of time, so I did not share the screen with you. The virus structure, jo hai, it's something like this. It's a ball with spikes. Okay, I'll just see the slide. Can I take? Yeah, that's one. Yeah, I will just share this slide with you. Just look at this. Yeah, so we have ये जो virus है ना, their body is covered with something called as antigens. Can you see the screen, everyone? So
Yes, ma'am.
this is the virus.
Yes, ma'am.
There's something like this key projection that you see out here. This is called as an antigen. It is made out of proteins. Okay. This is the thing that is bringing about a response in your body. Okay. And this cell, what you look at this thing, it's a cell of your own body. Okay. So you have this body, your body cell, wherein, here your body cell is produced another cell to fight with this virus. Okay, so when this antigen is going and attacking your cell body, what your body does is it produces something called as antibodies to fight against these viruses. Okay. So if your body has enough of antibodies, you will not get infected. तो already जो patient का infection हो गया है, उसके body में, उसके plasma में antibodies already produce हो चुके हैं और अच्छी मात्रा में है. तो ये patient का plasma को निकाल कर हम दूसरे patient को देते हैं जिसको infection बहुत severe है. So we are already giving a ready-made plasma containing ready-made antibodies to another patient who is severely ill. So this antibodies are fighting in his body now. Okay, am I clear with you?
One more question, ma'am.
Yeah.
Yes, ma'am. Do the normal people also have that amount of antibodies or not?
Yeah, a person with a good immunity, okay, if he has been exposed to any of if this virus or any other virus, okay, so that person will not have symptoms, but definitely his body will produce antibodies. Okay, so when your body is producing antibodies, you're strong enough. Okay.
Miss, may I ask a question?
Yes.
Miss, my question was the herd immunity is a type of acquired immunity or it's a innate immunity? Because innate immunity is a part where the immunity, it's an immune system which develops from the birth,
Yes.
and herd immunity, which means we have to acquire it, or by the vaccines we have to make the memory T cells or B cells.
Very accurate. It's nothing but it's an acquired immunity, like I mentioned to you. Your body is throwing out a response in the form of developing antibodies.
Miss, then memory T cells will form, no, for that.
Yeah.
That was my question.
Okay. So we all are developing acquired immunity or herd immunity. Okay.
Okay, ma'am. Thank you.
You're welcome.
Thank you very much, ma'am, and thank you, students. Requesting Shivam to please mute your mic. Shivam, please mute your mic. I now request Rutha ma'am to give the vote of thanks.
Yes,
Rutha
thank
ma'am.
you. Yeah, thank you, Crystal. Good evening, one and all. On behalf of St. Peter's Junior College, I, Mrs. Rutha Fernandez, extend a hearty vote of thanks to our chief guest, Dr. Merita Pushparaj, to spread this to spare the time from her busy schedule. Today, we had an opportunity to hear facts and misconceptions on COVID. This will surely enlighten our minds. I extend special vote of thanks to respected trustees of our college, Mr. Soman Thomas, Chairperson, Mr. Sanjeev Thomas, Principal, Mrs. Pevina Kolasco, Vice Principal, Mr. Bipin Vaiti, Supervisor, Mrs. Priyanka Bar, for encouraging and supporting to do the best. I would also extend my thanks to Mr. Rana as a extra technical system support and my dear teachers who worked behind the scene to make this event happening. Last but not least, my dear students for attending this event with discipline. Thank you.
Thank you very much. Thank you, one and all.
Thank you, ma'am.
Thank you, Dr.
Thank you, ma'am.
We're glad to have you.
Thank you, ma'am.
The session is now over. I request the students to leave the session. Thank you very much, ma'am.
Thank you,
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am.